That would have been bad.
I know.
Just wear a hat.
Yeah, it wouldn't work, you know, I become the hat interpreter.
You're on TV and all this stuff.
Do you want me to stand by the PowerPoint?
There won't be any speakers.
Tell her to get as close as you can to the microphone.
But there won't be any speakers on Zoom, so she won't have to move.
Right
Is
there.
that screen closer?
That's
now?
perfect.
Or do you want me to move it closer? Do you want me to move the screen closer? Or is it okay with this?
That way you can say, you can look, you know.
Hey Chief, how are you?
I'm good. How are
Good.
you?
Let me just check, are you here for?
I just happen to be here for any election related. If there's anything.
Oh, no, you should have one for. Cool, great. Hello, good afternoon. Oh, it's. All right, I think we're ready to get started. Let me just check on a couple of AV issues here. Okay. All right, well, good afternoon, everybody. And we're here for a little bit of an update on the situation in the metro area with respect to COVID and maybe a couple other issues that might come up. Obviously, it's sunny again outside, so I hope everyone is enjoying dry roads and some sunshine. And a few things to begin with from our Joint Information Center. So these are, again, just some generic updates. And then I want to let folks know we're really going to touch on enforcement. And so we'll be giving briefly all the summaries of the enforcement program that we worked on last weekend. But first, a few updates from our Joint Information Center. One thing is that starting Monday, the Mortgage Finance Authority is accepting applications for the Housing Cost Assistance Program. This is something we get a lot of questions on, and basically the Mortgage Finance Authority is offering up to $1,500 per month for up to 3 months to pay back rent or mortgage. So hopefully some great help on the way. The deadline to apply is November 13th, so it's quite short. Please apply at housingnm.org. And again, that's an update on available rental assistance and mortgage assistance. Now, a couple of other items. Senior hours. As a reminder, we are asking all of our big box retailers and grocery stores to do senior hours. And that is part of our emergency order, so it's a request, but it's also, again, part of the emergency order. And so we're working with our enforcement team, the Fire Marshal's Office, Environmental Health, and the Planning Department to increase our outreach to retail businesses to remind them that under the emergency order, they're supposed to offer designated hours to seniors and people with pre-existing conditions. Now, occupancy limits during this time are set at 15%. And so we have notified over letter various businesses with this. We're also calling folks this week. We're going to start enforcing it this weekend. So as a heads up, we will be, part of our enforcement package, we'll be making sure that folks have those hours set up. Now, this is a very important step. Obviously, Corona, and we're going to have a little bit of an update, but by now, if you don't know, Corona is just spreading at literally record rates in all over the country, but also in New Mexico and also in Albuquerque. And so this is a absolutely reasonable measure that we were already doing in April and May, and we've got to get back to doing now. So again, this is nothing new. This is about doing what we really should have been doing all along, but now we're recommitting ourselves to enforcing. Some other updates. The Cultural Services Department announced that the zoo and the Botanic Gardens, the Albuquerque Museum and the Balloon Museum, they're all restricting online ticket sales to New Mexico residents only. You can check their website. That's, again, additional regulations and restrictions based on COVID. There's numerous ways to demonstrate your residency, and so the standard techniques of driver's license or ID card, or even in some cases utility bill and so forth. So that will be required for folks to get in. Okay, update on EPD. We always get some questions about some of our larger departments, the number of cases. Want to remind everyone that for this entire time of COVID, we have experienced every week half a dozen or so cases in various city departments, and we've done a good job of containing that and getting those folks help and then keeping the city running. So we're continuing that, but our numbers are up slightly in some departments. So for example, at APD, we now have 29 current cases. Again, we're actually grateful it's only 29, given what other departments are going through in other cities, but we continue to work on that protocol, and that includes mostly sworn officers, but a couple of civilians as well. Now, I do want to share a little bit about where we're at in terms of public health, and our Dr. Mark Domena is here from our Environmental Health Department to talk about some of this. But of course, we're seeing a huge jump in our cases. And in terms of the per 100,000 measure, and with Halloween coming this weekend, it's really critical that we don't go from bad to worse. And the CDC has stated a number of guiding factors with respect to Halloween. And so we just want to emphasize, please follow really the 3 categories that are listed on the CDC website. And I'm sure these are also going to be echoed at various levels at the state too. But it's, understand what activity is low risk, moderate risk, and high risk. And again, things like inside haunted houses definitely pose real risk. We would not encourage those in any way. And lower risk activities include, decorating pumpkins, watching Halloween movies, these kinds of things. If you're in a particular pod or group with family or a couple of neighbors, just limiting trick-or-treating to that. And of course, making sure it's only outside. And masks, COVID masks are worn even on top of the Halloween mask. Just a way, because Halloween masks do not count or are effective when it comes to reducing spread. So we want to make sure you're also honoring that. Okay, now the recent surge also has presented a number of challenges, of course, to things like nursing homes and so forth. We are now seeing in El Paso what Albuquerque could look like in the next few weeks or months if we cannot get this under control. And so we don't see any need at this time to do things like a very strict curfew, which El Paso is now under. But we do want to let folks know that these are on the horizon. I don't want us to be El Paso. I never want us to be El Paso, and especially in this case. But obviously, you have to do what you have to do in El Paso right now is just doing what's in the best interest of public health during an emergency. And so we don't want to get there, and that's why we really need people to take care and listen to this information and just try and help each other and their loved ones out by following the recommendations. So with that, to speak to some of these recommendations and some of the figures, Dr. Mark Domena from our Environmental Health Department.
Thank you, Mayor. As you are hearing everywhere in the news, the nation is going in a very bad direction in terms of the increase in COVID cases everywhere. We know that the state of New Mexico is doing poorly, and we are no different here locally, Bernalillo County and Albuquerque. This is somewhat expected, but we really need to not give in to that. We need to continue the fight. Just last week, there were 1,275 new cases for Bernalillo County. That's up from about 100 cases, up from 1,185 the week before that. And that's been a continuous trend that we just keep seeing the new cases every week increasing at a faster and faster rate. That's very concerning. We know that this isn't just an issue of more people getting tested. The test positivity rate that comes along with testing tells us that more of the people that are getting tested are actually positive, and that's a really good indicator that there's much more coronavirus circulating in the population and the transmission is real. So in the previous week, it was about 4.7% for positivity rate, and then now up to 8.4% in Bernalillo County. So that's a huge jump in the positivity rate, and really highlights the concern about what we're talking about. The most current spread rate that we have is at about 1.15. And again, we want that to be as low as possible. We're doing very well for a while at the end of the summer when we were under 1. And again, all of these numbers have to do with the gating criteria that the state's following that allows us to progress with any kind of reopening or return to some of the normal things that we're doing every day. All of these numbers are blowing out what they need to look like for the gating criteria. The new, Mayor referenced the cases per 100,000. That's up now to 29.3 cases per 100,000. Last week before that, it was 26.7. But when we were doing better, we were down underneath the state's gating criteria of 8 cases per 100,000. So that's a huge, huge jump in terms of how many people out of our population are actually coming down with COVID, and very much a concern. I have mentioned this previously, but as we go into colder weather, cold and flu season, lots of conditions are going to make our transmission even higher, put people at even higher risk. Cold weather is preferable if you're a respiratory virus. Respiratory viruses survive better in the environment during colder weather. That's why cold and flu tends to be more common in the winter months, and we're going to see similar patterns with coronavirus. It's also a time when we start to move indoors. We're in more confined spaces. Nobody wants to stand out in the cold and the wind, so we tend to gather inside. And we're also going into a period of holiday season where people like to gather with their families, and we all know what those traditions bring people together into smaller spaces. So as we make decisions about how to plan for holidays and plan for the winter months, we need to be even more conscientious than ever about wearing a mask at all times, socially distancing. It's nice to want to get close with people, but still try to do it at that 6-foot distance. Think about the transmission when you're in close space to people. There should be a little bit of a feeling of claustrophobia when you're in a close room with lots of people, because that's when the risk is highest. We know it's Halloween this weekend and that people are going to want to take advantage of as many activities as they can, but we would encourage people to do the safest possible activities and be mindful of risk going into the weekend like that. The chart here beside me is actually showing the 7-day average and the daily totals of cases that have progressed since March 11th when this all started in New Mexico. You can see a bit of a bump in the summer. That was just after the July 4th holiday weekend. There was an increase from people just sort of getting into holiday mode and getting into summer mode. But you can see where that dips down again, and we got things under control. As a state and as a city, we did a really good job of understanding the risk and going back to the behaviors that were most protective. But now getting into October, that curve is going upwards and just continuing to climb, and the concern is very severe that we're going to get into a point where we're in actual uncontrolled spread. Mayor referenced enforcement, and I just wanted to tell you a little bit while I'm up here about what environmental health is doing with enforcement. Mayor had mentioned it earlier that we are going to start adding our COVID compliance inspections to what we call the red-green report. Anybody that's seen the red-green report in the paper or on the news, that's actually referring to places that have either the green placket or the red placket. We've adapted that a little bit for COVID compliance. A green indicator on this inspection report would actually, so you can kind of see what this looks like here. If it's in green, that's something that we went in, we talked to the person in charge, we took a look around, made sure that we had sort of observed all of the things that fall under COVID safe practices, and found that they were doing everything exactly the way we would like them to do. By and large, the places that environmental health inspects, restaurants, grocery stores, any place that has a food permit, they're doing fairly well because we've been working with them since the beginning of this, and they've been under the microscope a lot in terms of their behaviors. So we're finding largely that there's good compliance, but there's a lot expected of these facilities in terms of their customers and every employee that's in that facility. So if we see something, an employee that's dropped their mask for whatever reason, someone that didn't wash their hands, some of these things apply to food safety as well, but certainly in terms of COVID, we're very concerned to make sure that people are closely following those principles and those published practices that they need to. So if something appears in yellow on this report, that's going to indicate that we had to have a conversation, had to have a reminder, had to document that something was out of line, but it was quickly and readily fixed, and we didn't feel like it was very high risk. Occasionally, someplace is going to show up in red on this report, and that's going to be someplace that we either had to close outright because they were just so far out of compliance, because we've been back there a lot of times and we find that they just can't or won't comply, or because they've been sort of flagrantly and willfully disregarding the public health order and the COVID safe practices that we're looking for. We don't expect to see a lot of those, but we think that it's important that the public is aware of which facilities are doing the most to protect their employees and their customers. So we're still working out exactly how some of the tweaks on this report will look so that it's as digestible as a bunch of regulatory language can be for the public, but it'll be published shortly for people to see, and it will also be provided like we normally do with our food safety inspection reports to the media once a week, so that that same sort of red-green report that you're used to seeing can also reflect COVID-safe practices wherever we see that in enforcement. Again, just real quickly, please wear that mask. Please stay as far apart from people and avoid large gatherings, and wash your hands every chance you get.
Thanks so much, Dr. DeMena. And a couple of things on this report. As he mentioned, we've always had the red and green report. We're simply adding yellow is an indication that, again, there were some violations. But the positive news is that we'll say on the report, and they came into compliance. So that's why they're not red, essentially. And so for us, this is a real way to have some transparency around enforcement and just encourage everyone to really pay attention to these orders. And, green chili turns yellow on its way to red, and so it also fits a little bit with our red or green report. Now, we do also want to mention that I think we're going to be able to share the specific rules and regs for the color coding probably tomorrow or Friday. So we'll be doing an official release from the Environmental Health Department. So if you do have questions like specifically, well, what's this and what's that and so forth, just stay tuned. We want to have it basically ready for the weekend. Again, we want to encourage compliance, and we want to also hold up folks who are doing a good job. And so appreciate everyone who's green on that report for in advance making sure that all these different regulations are followed. Okay, now let's talk a little bit about a couple of other issues. First, following up on enforcement. A couple of things. This weekend, obviously, we essentially did an enforcement blitz around Corona on a number of different fronts. And I want to preview a little bit of what happened this weekend. You can see that overall we had the number of enforcement actions, compliance actions right here in August. You can see it did go down quite a bit in September. And, we were all feeling a lot better about COVID in September. So that sort of matches. And then we see, of course, in October, our enforcement numbers going way up, and even in the last 7 days. So basically over this weekend, we did 1,500 enforcement actions all over the city. And we'll talk a little bit about this, but for us, you can sort of do the math. This is basically double what we had been doing in the past. And it's something we're going to have to keep doing, unfortunately, until really the numbers change. So let's take a look at the next slide, too. Again, we do enforcement on a wide range of areas and establishments and so forth. This is a map of where the enforcement activities took place. Obviously, you can see a lot of dots. That's because we did a lot of enforcement. Again, over 1,500 enforcement actions. And so for us, here you can see too, there's a lot of corridors being targeted, and that's where there's big retail and the potential for mass gatherings. And then we did do some activities again at parks and at open space, primarily just getting people to wear masks. And again, we want to just make sure people are complying. That's the most important thing. And so when there is a stronger action required, APD is called. I believe there are about a half dozen citations. And we do a notice of violation as well, and there were several hundred violations. And those were all handed out again in accordance with, if you just follow the rules, then we'll be on our way. But obviously when folks really refuse to, then we will use that sort of escalation method to bring about compliance. Now, I think, too, we just want to highlight it's a citywide effort, and in some ways, the metro area effort, and it's something that we're going to have to continue to do in different areas each weekend until this changes. So Friday, we'll probably be sharing what we'll be focusing on for this coming weekend. Now, some other details on this that I want to mention. So a lot of folks have been asking about some of the details, so I'm going to share a few of these here with you now about this range of compliance interactions. We had 302 violations, notices of violations, 7 citations. We had, in just this weekend, 1,469 compliance interactions. The fire marshal's office used 14 inspectors to work on this. They focused mostly on city parks, even skate parks and pavilions. I think this is, an issue just because of mass gatherings. We know a lot of people like to use those pavilions, but right now, again, it just it interferes with the concept or with violations of mass gatherings. Code enforcement, we had 5 code enforcement inspectors working on your big box Home Depots, Lowe's, malls, retail, sports venues, bowling alleys, volleyball venues, and so forth. Our environmental health department team had 6 inspectors. They were focused on restaurants, breweries, and grocery stores. And Parks and Rec had 32 staff working on our trails and out at our parks. And of course, we did have our party patrol working on the weekend, especially some of these challenges that we've had. There were 7 violations issued with respect to large gatherings in houses constituting a party. There were about 14 complaints for parties. And this is truly a citywide effort, again, spread across every neighborhood, spread across every regulatory department that we have. And it's also something that tries to free up key law enforcement, meaning our police department, to keep them not involved in this, because we desperately need them working on violent crime, as we know. So we appreciate all these other departments stepping up so that APD does not have to pull resources away from 911 calls and 242 cops calls. So again, please make all public inquiries or requests or concerns about public health order violations to 311. Do us a favor, don't use 242 cops, and please don't use 911 for those. Just call 311 and they'll get it to the right enforcement agency. A couple of other items on this. We do know that potentially there are certainly high-risk areas that we're going to look at again this weekend. We also handed out 400 masks to the general public. And at our airport, we handed out 4,500 masks in the month of October. So the airport continues to have extremely strict policies. And ironically, when people get on and off the plane, they're not always following them. So we are meeting them right there and making them wear a mask. So the airport's doing a very good job with that. And again, direct all complaints to 311. And we'll investigate and educate and issue notices of violations if needed. A couple of other updates, a little bit on our homeless shelter. If you didn't hear yesterday, we did share that fortunately our homeless shelter, the West Side Homeless Shelter, again, this carries the biggest brunt of the homeless population out in our West Side shelter. That was able to reopen to new folks on Sunday. This was critical because there had been an outbreak there. We were able to safely reopen it on Sunday, and that was right before the cold weather hit. So that shelter remains open to anyone who needs to use it, and we certainly want to encourage any homeless folks, or if you see homeless folks, call 311, and we will try and work to get them out to that shelter. And now it is under the public health regulations, again, available for folks. A couple of changes. One is we continue to spread out that population, and so we have been using an additional hotel to put various homeless populations in with respect to the public health order, and now we have a second hotel we're doing that. So when we refer to the West Side Shelter, it's actually the West Side Shelter plus 2 additional hotels. And again, those hotels are used for situations of either high risk or positive cases and so forth. And right now, fortunately, thanks to our great partners and to a lot of donations, we are able to provide meals at all 3 of those locations. Again, something we've never been able to do before, but Albuquerque continues to step up to try and help there. All right, a little bit on economic development. Early in the pandemic, we rolled out our $750,000 worth of business support to about 150 local businesses. And we have the PPE. We did get it from local vendors, which is really helping them out a lot. Obviously, it took a little longer than we wanted it to because of that, but there is an upside in that we're actually helping the local economy as well in those small businesses. That is finally going to get out to the chambers the end of this week and this weekend, and then the chambers should be distributing it as per the agreement next week. Now, we've waived about $1 million in fees for small businesses. We continue to do that. The hold on all sorts of business-related fees is still in place as per the emergency order. So it is a great time, by the way, to file all your paperwork at the city. And we are also, of course, continuing to fast track our construction projects. So we're now up to 120 million in projects all around the city. And you can see most recently a lot of medians and street work being done in new areas around town. East Central, Carlisle, and I think we're finishing up Unser and around Ladera. So also, 104 restaurants have applied for a grant for outdoor seating. And the city's put in nearly about $100,000 into supporting folks with the outdoor food truck courts and growers markets that have been continuing. And on Monday, just a couple of days ago, we put out the applications for the $10 million in economic relief to local small businesses. This is a huge relief package, and we want to encourage everyone to apply. You can call 311. You can look it up on the website, but as a reminder, the application window is now open for that $10 million. Now, this is part of the CARES Act. It's part of our relief. We're going to get all this out the door before New Year's. And we know that the pandemic has hit local businesses and workers in many ways the hardest, and so that's who we're prioritizing. There are 3 batches of funding that we're rolling out. One is going to be the application window is open this week. Then we're going to have another application window open November 9th through the 13th, and then another application window open November 30th through December 11th. So again, there's 3 chances to get that. And available funds, if they're oversubscribed, are going to be done on a lottery basis. You can find out information on that at cabq.gov/economic development. And there are applications available in English, Spanish, and Vietnamese. Now, let's talk a little bit about how our city is doing as we wrap up here. We know that our state, unfortunately, has some of the highest increases that we're seeing around the country. And we also know that the rest of the country is also spiking, and of course, so is the metro area. But we try and also look at, all right, where are we with respect to other major cities in the Southwest, or at least in the Western region. And so I want to highlight a couple of things on this as we look at this. Number one, we have lost a lot of ground here on our positivity rate. We used to be almost twice as good as every city around us. And now, fortunately, we are still doing better than Tucson, better than Austin, better than Phoenix. You can see Salt Lake has double the problem we do. And still, again, doing a little bit better than El Paso and then Oklahoma City. But we used to be beating Denver, and so now Denver is a little bit lower. So with respect to positive cases, this is a situation, too, where we're actually, we've got to continue this and do the best that we can, but we are in a much better place than these other cities. And again, these are just where we're at. There are many more cases per capita, per 1,000, in all of these cities, Denver, Tucson, Austin, Salt Lake, El Paso, and Oklahoma City, than us. And of course, you can see major problems in El Paso, and I talked about this at the beginning. Their rates are almost 3 times higher than ours. So this is just how we stack up, again, around other cities. So we continue to watch this. And look, our positivity rate is an area where we are losing ground with our peers. But I also want to remind folks that I'm grateful to live in Albuquerque. We are literally a healthier and safer place to live than these other cities. And it's a credit to our state, it's a credit to our hospital system, and to all the folks who are involved in dealing with this pandemic. So I am grateful that we live in Albuquerque. So I think with that, what we will do is transition to our question section. And due to the pandemic, we don't have quite as many people available. So just depending on your question, we will always get you the right person. But if we don't have the expert actually on the phone, we'll just get you the person on a one-on-one basis. So with that, we'll take some questions.
I have a question from Ryan Laughlin at GOV. How concerned are you that our hospitals could be overwhelmed? And do you consider that a real possibility?
The question is about our hospital system being overwhelmed, and this is something we're looking at very closely. I think the state is going to have a more detailed breakdown of this tomorrow, so I would essentially stand by, I think, for the latest information. But the short answer is we're certainly concerned. We also know that our state and our hospital systems in the metro did a great job of adding flex capacity, which, by the way, I had a number of people think that I was saying flux capacitor from the Back to the Future movie. Close. But this is flexible capacity that is, extra beds like at the old Loveless healthcare facility that we now have. So yes, we're concerned, but I also know we do have a fair amount of flexible capacity remaining. And let me just check, Dr. Demena tracks this on a daily basis. Do you want to add anything else to that? It's up to you.
Just
If you do, go ahead and come on up.
I think the reason that the question came up, this is a concern that we've talked about since the beginning, and it's just a moment to remind people, with the trend going the way that it is, if we continue on that trend, then it will be a question of when we reach capacity with hospitals and when we have to start thinking about people being in beds and hallways and there not being sufficient medical providing staff to take care of those people. So that's why we're pressing this issue so hard. It's not just about having better numbers to put up for people, but we're very concerned about the hospital capacity as an eventual potential outcome if we go in that wrong direction. So, we're going to continue to urge people to think about those consequences. Think about what it would be like to be told there's not a bed available if you're suffering with COVID or someone you care about is suffering with COVID. We're not there yet, and as Mayor mentioned, the hospitals have done a great job of having plans in place to expand their capacity as needed. But especially with something like this that removes medical providers from the pool of available workers because they might get sick or they might have to take care of loved ones that are sick. These are the kind of real life scenario that we worry about being a stress to that system. So we just need to continue to try to reverse that trend.
Okay, other questions?
I got another question from Jessica Dyer at the Journal. Has the city established some COVID benchmarks for when we would implement measures like a curfew?
So the question is, do we have benchmarks and so forth with respect to things like a curfew? And, what we're doing is right now the state obviously has their criteria, so we're really queuing off their criteria. We don't see the need to have a specific criteria for us at this time. I also want to mention that, criteria at a statewide level certainly makes sense, and I think it's been a smart way to use data. As you get more and more local, you have to be careful with criteria because there's so much population flow in and out of the city. So we, again, want to always use science and information and data, but I don't think we want to be locked into a specific number. And so that's basically where we're at in our thinking at this time. But I'll tell you, the biggest thing we are looking at is hospital capacity. So if we actually are bumping up against the flexible hospital capacity that we have, that's a situation where we're going to have to do literally everything we can to protect our healthcare workers and those who are in the hospital. So if that world becomes apparently about to happen, then we will absolutely look at every tool available. Okay, and I think we don't have any more questions at this time, so we'll wrap it up, and we'll hope everyone stays safe, healthy, and warm. Thank you. Bye.